Okay, good evening, everyone. We're going to start in a minute. I'm just setting up. Again, I can't understand why it quick switches me places. So let move to the side, 1 minute. So you can see the PowerPoint. Okay, good evening, everyone. Hope you're all well, especially in these days. We have a wonderful opportunity to give knowledge online, especially that we staying at home. Whoever has not muted his microphone, please do so, because every movement you make, everyone can hear it. I have to see why I can't see myself, because it's important. 1 minute. Okay. So, okay, so good evening. On us with online, we also have Avi Amir. Avi Amir will be, we teach together, we business partners, we run the same clinic together. He's going to be, he will note if you have any questions. Avi, you can say hello, so people can know who you are.
Everybody. Hi, good evening, everybody.
Okay, so Avi will be noting and taking down questions. In your chat box, you can write questions. When he sees I should stop and answer, he will stop me so we can answer the questions. So I hope you enjoy it. This is why I'm trying to make it as practical as possible. Sometimes it's a bit more difficult online to do a hands-on seminar, especially in showing location of points. Hopefully we'll bear with us. We'll try to do this as best as possible. When there's difficult points, we have a few videos that we'll show and we'll run through you. So with that, we begin. So this is basically this evening seminar, webinar. I'll be speaking about these points that in Yamamoto's group of points, he has a couple from 1973 when he first discovered his first point, or published his first point till today. We've accumulated over about 60 points. Most of the points are categorized in certain groups, in about 4 major groups, where in the last couple of years, there's been other points that can be used, that not necessarily have to do the whole diagnosis, but they're very, very useful. They're like magic points, very, very useful to use them. And it's very easy and very easy to learn them in the location. You can always, you can combine them in your clinic as just like the Chinese extra points. You can combine them in the clinic with a regular TCM treatment or other channel theory, stems and branches, what other body acupuncture you do. So hope you enjoyed and hope you found it useful. So now why is my... Okay. So I'd like to start with this first sentence of Yamamoto. They said, if you don't give up at the library, the paralysis and pain will heal. It's kind of the spirit, for me, the spirit of this YNSA method. A lot of his discovering of the points is done from this, comes out from understanding the sentence. Basically, he's trying to say, you just got to try again. And if you first don't succeed, try again. That's what he's trying to say, but he's also trying to say, also be more open-minded. When you come to think about a library has a lot of knowledge in it, but it's a lot of statistics. And sometimes human beings are not always in the statistics. So you can always, if you keep trying to help them and try to think out of the box, in the end you can help them, because the mind can constantly change. And basically that's what he's trying to say here. You have to keep out of the box, and if this point doesn't work, maybe a different point will work, or different way of working. will work better with each patient. Oh, let me see why. I'm just gonna do something quickly because I see everything. The pictures have moved around. Every now and then I'm just going to jump in and move the pictures around so you can see them. Avi, רואים את הזה? Can you see me and the screen?
Now we just see you.
Beg your pardon?
We're seeing only you now.
Okay, share screen. Okay. So I'm going to just go. Every now and then just play around with the PowerPoint so you can see the images. So basically, if we come in to speak about scalp acupuncture, YNSA is a scalp acupuncture method. We have many types, many microsystems in the scalp. And what you can see here in the image that you see in front of you is kind of 6 different maps without YNSA of 6 different practitioners or developers of the modern scalp acupuncture. Now, when I speak about modern scalp acupuncture, I'm speaking about in the last recent years, the scalp acupuncture has developed from the 1950s still up until today. But before that, even in Beijing, the Yellow Emperor, it is being mentioned using points on the scalp to treat neurological disorders. So even there you have those points. Speak about a couple of them just according to the indication through the neuroanatomy. But you have here in the picture in front of you, have 6 different images combined together of scalp acupuncture, modern scalp acupuncture. Here, as you can see in the image, again, sorry, I'm moving it around. Okay, here we have, again, we have 6 different scalp acupuncture methods. Someone, can he turn his mute off because you keep hearing it? Turn his mute on. Okay, we have 6 different maps of scalp acupuncture, all developed by different practitioners. Where we hear here, what we can see here, where I'm pointing on my with my mouse, this is Jiao Shunfa. Jiao Shunfa is known. אבי, אתה יכול למצוא את מי שעושה את המיוט ולעשות לו מיוט? תפתח אצלך שלם.
אני מנסה.
Okay. Sorry, we're just trying to mute the... Okay, so we have 6 different maps again, sorry. We have Jiao Shunfa is the founder of the modern scalp acupuncture. Okay. Basically, his general idea of the modern scalp acupuncture was taking spot points or areas on the brain and matching them to the neuroanatomy. And by needling, please, I'm asking whoever is moving around, please mute your microphone. We cannot hear anyone. Please make sure your microphones are muted. Thank you. Okay. Okay. Sorry, we have to bear with us. אבי, אתה גם יכול לסגור אותו מתוך המערכת.
כן, אני מנסה להבין איך עשינו את זה בכלל.
Okay. So, sorry. Okay, so back to Jiao Shunfa. He was basically taking the modern scalp acupuncture is based on neuroanatomy. So the understanding of the neuroanatomy and how the central nerve systems and mapping out the central nerve systems, this is actually where the lines and the points were located on the scalp. And by needling these points, just says neuroanatomy, contralateral. If I have a disorder on my right side, I would needle the left side. And if I have a problem in the body on the left side, I would needle the right area of the scalp. And according to 2 major lines, which are the motor lines, okay, and the sensory lines, according to the homunculus of the body. Those were the first lines that came up for Jiao Shunfa. And the needling method was actually a threading method. And as I said, because it grew together, taking a Chinese understanding and wisdom and actually using acupuncture to stimulate the brain, at the same time taking neuroanatomy, as neuroanatomy developed, also scalp acupuncture developed. They actually developed together, and also understanding how points, the theory of how the points work and how the locations work mixed in and blend into each other. But what was all these developers of these, all these Chinese practitioners and neurologists, actually they were neurologists that developed the scalp acupuncture, were speaking about the same thing, that, and even Dr. Yamamoto, that if you rewire the brain, you can rewire, you can treat any disorder of the body. You just got to rewire and reprogram major computers. So that's what they were looking at, to rewire a new major computer. And that coming to it and thinking how it was up to about coming into it to up to about 25 years ago, they were kind of ahead of the field by saying that the brain can change, constantly change, and constantly make new connections, especially speaking about areas that have been damaged. What was believed up to 25 years ago was that a certain area of the brain, if it's damaged in childhood, in childhood your brain develops. After childhood, your brain stops developing, and each area has a function. And after that, when those areas are damaged after those years of childhood, you cannot receive that function again. That was believed up to 25 years ago. But today they actually understand that the brain is constantly has the ability to change and readapt itself, what is called neuroplasticity. But it's not that new neurons are developed. Actually, what is happening, we creating new synaptic gaps or new synaptic connections. And then by making new synaptic connections, we overlapping the areas that have been damaged. Just for an example, if a patient, for example, has head trauma and the area of the arm, for example, of the hand is being damaged on, let's say, his right hemisphere, and then he's affecting his left hand, and now he's having difficulty moving his hand in some manner. So the understanding is, if you keep stimulating it in any manner, the hand, in the end, the brain is going to readapt itself or make new synaptic connections, and then the function of the hand will return. And so that was neuroplasticity, and you can see it again and again. That's what they do in physiotherapy in rehabilitation. You want to stimulate through the sensory nerve system and let the brain readapt itself and reorganize itself and overcome the area that is being damaged. Again, I have an image here. I have to just move it. Okay. Coming to speak to a bit about these acupuncture points, in that understanding with neuroplasticity and taking the matching neuroanatomy according to the location of the points, we also understand why some certain points do a certain action or certain function. For example, if we take DO20, for example, by needling DO20, one of the indications for DO20 is paralysis and pain in the lower extremity, especially around the foot. And if you take the location in which you're right about here at the vertex, approximately the area of the vertex, DO20 sits right at the top of the homunculus of the sensory area of the foot. So that's also according why the location of the point has that certain indication. Again, if you take UB9 affects the vision. If you think where the point UB9 sits right in the vision area of the brain, the occipital area of the brain. Yin-Tan affects melatonin because it sits on the pituitary gland. Gallbladder 7, gallbladder 10 affects the arm in some manners, or the leg in some manners, because it sits right on the areas of the homunculus of the hand and arm on the motor cortex. So that's just an example of the location of the points. So with that understanding, you can understand that they were actually basing their knowledge on scalp acupuncture on neuroscience. And the same, now coming to Yamamoto, Yamamoto's scalp acupuncture is, so I'm sorry, I'm going back to the methods of the scalp acupuncture. If you take the modern scalp acupuncture and you start mapping out and seeing where all the points are located and all the zones or all the microsystems that are there, they kind of match the precise area of the brain. Then we come to Dr. Yamamoto, where his method, which is a slightly only 3 years more modern than the other scalp acupuncture, like 1970, the first publications of Jiao Shunfa came out of his scalp acupuncture, who is known as the founder of the scalp acupuncture. And Yamamoto developed, due to working with the Chinese scalp acupuncture, he discovered different points, but already his system has become more of a microsystem and less the neuroanatomy. And his microsystem is also built in a manner that also starts because based also on palpation, body palpation as a diagnosis and not a diagnosis according to the symptoms. His method is also, he has a certain area which it actually combines and matches the channel theory as well. So you can treat channel theory with YNSA, which is, that's kind of a bit of a leap in the Chinese scalp, in the scalp acupuncture. And his method is very different because it's like he says, my system is a microsystem. And you'll see that the points are not necessarily match the neuroanatomy of the brain. Maybe they do, they just haven't discovered it, but you'll see as we go with it. So first of all, about Dr. Yamamoto. Dr. Yamamoto today is around 90 years old. He's in his life work, he's built a hospital where his method is being practiced, a rehabilitation center where his method is being practiced, and an old age home, elderly home, where also his method is there being used. He's an anesthesiologist. He studied, finished his year in 1956. He finished his studies. But to make a long story short, in his Yamamoto traveled. He was in the US for a couple of years. Then he done an internship in anesthesiology. Afterwards, he flew to Germany. In Germany, he wanted to change his profession to specialize in obstetrics and gynecology. And after a few years, he came actually back to his hometown, which is Nichinan, Oishima, Japan, which is actually an area which there's a lot of agriculture. And a lot of people that were coming into his clinic were people that were coming in from hard work, suffering from pain due to the hard labor in the fields. So Yamamoto found himself actually managing pain in the end, unless they're dealing with gynecology and obstetrics. And because Yamamoto was very open-minded, he's always looking for different ways to treat the pain and use less drugs to treat the pain. So basically what he was, a lot of time he was saying he was doing is actually injecting neuroblocks into the sensitive areas or the pain areas to stop the pain. And he was always dilating the lidocaine. He was always dilating the lidocaine with a saline. And he was doing that for a couple of years, and he was never interested in acupuncture. And then one day, a patient came into his clinic, female suffering from a herniated disc with a very strong, intense radiated pain throughout the leg. And he located a sensitive point, he gave her the injection, and she actually responded in a very, very peculiar way. And this puzzled him. How come she felt such a sharp, painful injection, which is very rare what he saw that happened. And as the day went on, at the end of the day, what he actually realized that he never injected any drug. He just injected the saline. So the next day when the patient came back, he was actually sure that he'll be sued here for medical malpractice. But she actually came back to thank him and said that the pain was gone completely and she feels great. And then slowly, this word started spreading that there's this doctor that gives a very painful injection, but at least the pain is gone afterwards. And that was actually when Yamamoto started being more and more interested in acupuncture. And he started studying acupuncture, learning more about acupuncture. He started using acupuncture in the clinic, started using acupuncture in the operating rooms as an anesthesia. Also as a general anesthesia. A lot of times he was using it for a general anesthesia. He was doing a lot with operations for appendicitis. The combination he used to use is stomach 36, spleen 6, large intestine 4, liver 6 with electrostimulation. That was generally the combination he was doing. One of the things he was saying that in the operating room, patients that received acupuncture during the operation were actually, especially when you're speaking about intestine operations, the intestines were very, very relaxed and very calm, and the body was very calm. So the operations were a lot faster and a lot easier coming out, and then also less complications after the operation. Okay, and then and he started using, like I said, acupuncture in the clinic. Now Yamamoto was influenced by a lot of, he was very influenced by microsystem acupuncture as Sujuk, auricle acupuncture, wrist and ankle acupuncture, nasal acupuncture. Was very, very influenced. So in his way of thinking, you always see him think as mirror reflects. Where does this point mirror reflect to a different area? And you'll see that sometimes you don't understand how he got to it, but sometimes when he explains how a mirror reflects, you suddenly see the connection, how a certain area on the scalp really looks like that certain area in the body, throughout the body. In 1970s, when the Chinese scalp acupuncture came out, he went and actually learned the Chinese scalp acupuncture, and he started using it in his clinic. And then again, by accident, he was using it, getting great success with it, once he's managed to master the Chinese scalp acupuncture. And then one day a patient walked into to his clinic with spasticity and shoulder pain. And he actually, when he was looking in the area here, for the area of the shoulder in the Chinese scalp acupuncture, he found a sensitive point up here in the temporal zone. And when he pressed down on that area in the temporal zone, the patient felt the shoulder pain subside. And then Yamamoto said, oh, this is a point. And he started testing this point on other patients, and he started seeing that it works. This was Yamamoto's first C point that he discovered. After that, he said he started connecting the dots. Okay, he had the area of the shoulder, which was the C point. He had areas here right in the anterior body from the Chinese scalp acupuncture in the mid-sagittal line, which from Chinese scalp acupuncture is very, very effective in treating headaches, migraines, problems with the sensory organs. And he started saying, if I have the head here, the shoulder here, then maybe I have an area in between. And as I go down, I'll have the whole body. And that was his first microsystem, where you have down here the lower extremities, the lower body, and etc. And for the first years, he developed actually first 5 basic points, which were very much used in the clinic. And he was getting great success in managing pain with these points, treating neurological disorders with great precision, with great success. Slowly, these basic points became 9 basic points, and today it's become a whole bunch of group of points, like I said. So, like I said, YNSA is a microsystem. Okay, just as Yamamoto said, just as Sujuk, auricle acupuncture. What understanding is that any disorder throughout the body will actually appear up on the scalp. And usually that area that appears up on the scalp, you'll see some abnormality sometimes, but a lot of times that area will be very sensitive. And then by needling that area, you have the effect on that area that's been damaged. Because Yamamoto thinks, now he also developed diagnostic areas, but we're not going to go here into the diagnostic areas, a bit more difficulty. Like I said, I mean, more in the magic points that you can use, and they usually needle ipsilateral to the side of the disorder. So we're going to stay there, but in his method, like I said, he developed a diagnosis because he always thinks that everything is holistic. It's not only like if you have a problem in the hand, you just needle the area that treats the hand. You have to discover where the problem is coming from and treat the root. And using the diagnosis, you can actually treat the root. And then if the symptom doesn't go away, then you just needle a point in the area for the hand, for example. And that's his way of thinking. But that's later on. So like I said, Yamamoto, YNSA is divided, his points are divided into 4 major groups. He has the basic points, which are the fundamental of the whole method. He has brain and sensory points. Then he has epsilon cranial nerves, or actually the connection between the channels, or the TMN channels and the channel. That's already a connection to the Chinese medicine. And then really start speaking more in our terminology. And I like the sentence that I put here that Yamamoto, in one of my meetings with him, in my last time I was there, he said that YNSA is like a flower. As time, it blossoms and changes. So even points what he understood in the past would be useful for certain things, he actually discovered as he went forward that they're useful also to treat other problems and other disorders and other symptoms. And they constantly change. Maybe some other point, those points that he thought, let's say for treating, let's say the arm, suddenly sees it's more useful for treating the foot and less the arm, for example. Coming to contraindications, always important to speak about the contraindications. So there's only one major contraindication, and the major contraindication is a fever of 39.5 degrees Celsius fever. And that's the only, what he says, the patient is anyway fighting of a pathogen, external factor, let the immune system treat it and don't give any more stimulation to the body. The body will not have the capacity to also have a neurostimulation at the same time. So let the body fight off the pathogen, and then if necessary, use the YNSA afterwards, once he feels better. So that's the only major contraindication. Also, it's very difficult because the points are located on the scalp, and if the patient has a full skull, you're not going to penetrate the skull and get to the bone. The only thing that might happen is that if you needle the skull, that the patient will feel a headache for maybe 3 hours after the treatment, or sometimes bleeding, but you will not cause any damage. So it's a kind of a very safe method to use. It's also a very safe method to use at all stages of pregnancy. Like I said, Yamamoto has in his background, he's obstetrics and gynecology. So when I asked him this question, he said, no, you can use it also for all stages of pregnancy. So that's also great. You don't have to think which points, not points. In general, a lot of points on the scalp are not useful during pregnancy. So they're very safe to use. Okay, coming more into the method. In the years I've been practicing the YNSA, and Avi have been practicing the YNSA, we've always tried to understand how does this method work? How does YNSA work? And in the beginning, we've come up with a lot of theories. And then one day in our clinic, a couple of times, I was treating a patient, and actually, when I inserted the needle, I didn't have such a good response. Because usually when I studied scalp acupuncture, especially Yamamoto, the area that I was told to needle was below the subcutaneous tissue, between the subcutaneous tissue and into a gap there where there's no tissue and the skull. And that's the area which I was told to needle. And then I was not getting any effect of the certain patient. And then as I just pulled out the needle very slightly, suddenly I had this patient feel like an intense pain, like someone hit him on the head for about a second, and then the pain was gone. And then suddenly he had a dramatic effect and improvement in the treatment. And then I started thinking that maybe this is not the, then I started testing on other patients, and I started seeing that if I could get to the fascia level, to the connective tissue level, I would have a better effect on the patient. Okay, so, and I was seeing that was the effect. And at the same time, I have a friend that's a physiotherapist that works with Steckel's method of fascia manipulation. I started getting into discussion with him, and suddenly I started seeing a lot of the information he had, and the information that I had from scalp acupuncture, and the information I had from Chinese medicine and acupuncture started connecting to each other. They said, okay, maybe this is the mechanism that that the scalp acupuncture works. It actually works through the fascia, through the connective tissue. Now, whoever knows, if you think about how the nerve system works, the nerves works, first of all, get a sensory stimulation. The sensory stimulation information goes up to the brain processes the information, and then responds to that information. And if we come down to the fascia, about 90% of the fascia, 90% of the sensory nerve, peripheral sensory nerve sits on the fascia. So if we needle the fascia in a certain manner and manipulate it, we actually causing the mechanoreceptors on the fascia to send a signal to the brain. So that was the connection. I started saying, okay, the fascia might be the connection how to get a better effect with the Chinese scalp, with Yamamoto, or in general with acupuncture. And if we go into acupuncture, the same idea. If you think when you needle, put a needle into the patient, then you twirl it or turn it around in some direction, the fascia, the connective tissue, mixes around it, and you cause the connective tissue to stretch. And the connective tissue stretching causes the mechanoreceptors to stretch, put pressure, and then send a signal to the brain. So that's also the connection, how the maybe acupuncture works. So that was how I started understanding it, and I started testing it on more and more points of YNSA that are necessarily on the scalp, also on the area of the foot that we'll learn today. And when I needed the fascia, I was getting a better response. Now, whoever knows, all your organs in the body, your whole body is a whole. If I would strip away the organs, strip away the blood vessels, strip away the nerves, you'll see that I would have this whole plastic bag, which is actually the fascia, which is connecting everything together. So that's why I thought that the connection was actually working through the fascia would give me a better response. So that's why I'm coming back to the needling method. When you come and you locate the point, like I said, it has to be sensitive, and you palpate it. When you palpate it, you start locating that there's a little granule. And then by needling that little granule, it's actually a granule that's accumulated on the fascia. And then by needling that little granule, you're recording some reaction in the fascia, which is sending a signal to the brain, and then causing it to work. Now, like I said, this is my hypothesis, how this YNSA works, but I think also this is how acupuncture works. And then coming into more and more research, I actually stumbled on to Dr. Helen M. Leving, who actually speaks about the connective tissue, with how acupuncture works on the connective tissue, and how the stretching of the connective tissue, I'll try and move it so you can see. This is an article that she writes, a connection of how the connective tissue works with acupuncture. And she does histology cut-ins with needle in there. She tested it with needles. Very, very interesting research. I recommend to read. She explains how acupuncture stimulates the connective tissue, and through the connective tissue, most probably this is how it responds to the body. She also speaks about the connection between the connective tissue and stretching, how it's important. So I'm leaving it here. So that was also finding, I had someone who was doing evidence-based research on this and connected what I believed how acupuncture works to the fascia and the connective tissue. So that's how I believe how scalp acupuncture works, and especially how YNSA works. Because in scalp acupuncture, you have to manipulate the points. Now in Yamamoto scalp acupuncture, it's not necessary to manipulate the points once the needle's inserted. And one of the reasons that Yamamoto says you don't have to manipulate the points in order for electrostimulation is because constantly we move in our face. Constantly our muscles in the face, our head is constantly have motion. And that motion, in some manner, is stimulating the points in some manner and stretching the fascia and causing a connection. Now, if you come back to the fascia of the scalp, we have the area of the temporal. And we got to think that in the sutures, the fascia also goes through the sutures and covers the dura covers the brain, and also goes from the base of the bases here and goes up into the bases of the brain. So that's also how fascia and the base of the brain, the connection between the two, especially if you need it on the scalp, how it has a straight up effect on the brain. So with that, that's general idea and knowledge on the scalp acupuncture and how I believe it works. So before I continue to the points, which are the most important here, I think, I'll see if there were any questions. Avi? No questions. Okay, so we're gonna continue. So, first 2 points we're gonna speak about is for toothache, and actually also has an effect in shoulder pain. Wait, I want to just move this. Oh, okay. Oh, okay. So these 2 points, which you can see here where I'm pointing with my mouse, okay, where I point with my mouse here, are points that affect the mouth and toothache. Okay, it has an oral effect. Usually you needle, when you have an area damage to your mouth, and certain area on your mouth, you needle these points. So you have upper oral area and lower oral area. That's right here in the corner of the eye. If you put your finger there in the corner of your eye, if you go up a bit, you feel there's a little gap. There's like a little suture there. That's the upper oral area. And if you go slightly down, the nasal bridge actually suture there, that's the lower oral point. And that's the upper oral will treat the upper mouth, the lower oral will treat the lower mouth. So it's also a good point for treating TMJ points, also bursitis areas, also toothache. Now, coming to toothache, there's a diagnostic area for toothache, which sits right here where you can see the black points. The reason is sometimes when a patient suffers from a toothache, he actually feels the radiation of the pain. And because of the way the nerves are built there, he's actually made to have a problem on his left side, but actually he's feeling the pain on the right side. So that actually to know which side needs to be needled, you have a diagnostic area here, which is right on the medial part of the sternoclavicular joint. And sternum, on the sternocleidomastoid tendon there, okay, right there. So right there, you can feel like it's very round. The side that is more sensitive, that's the side you needle for toothache, when the patient has toothache. But if you know the patient has a certain disorder in the area of the side of the mouth, you can needle ipsilateral to the area of the mouth. Now, like I said, it's also very, very effective in treating shoulder pain. Shoulder pain, especially for horizontal abduction, horizontal abduction, and internal rotation movement. Okay, so you can just palpate there, needle this area, and it would release the internal rotation, like closing the bra or scratching behind your back. Very, very effective in using that, especially today. We could see more and more patients or more people coming into the clinic with shoulder pain. So those points are very effective. Now, the reason why... Yes, Avi?
Before we continue, people are asking to enlarge the picture because it's not so clear. Okay, so
I'm cutting out the writing, okay, guys? So you can see the picture enlarged. Is this better? Okay, so I enlarge all the pictures. Okay, so as you can see here, right at the corner is the oral point. Like I said, now the reason it affects the shoulder in that manner, because you have nasal acupuncture. Like I said, Yamamoto was affected by nasal acupuncture. In nasal acupuncture, here is actually the armpits. This is the arms. This is the body, the trunk, and these are the feet. So you also have here is the anus. So you have hemorrhoids, for example. Okay. So moving to the next points, which are another combination of a couple of more points. I'm enlarging them here. But these points affect, one is for gastrocnemius. It actually releases and relaxes the gastrocnemius muscle. Okay, and it's right at the posterior border if you have the temporal mandibular joint. Okay, it's right on the posterior border of the temporal mandibular joint. So if you go right down here into the temporal mandibular joint, on the posterior borders, you feel area is very, very sensitive. you can needle that point, and it actually relaxes the gastrocnemius muscle. So it's also very, very useful for heel spurs and plantar fasciitis. So that's the gastrocnemius point. The second point, which is very, very useful, it's what is called foot point, which is right on the zygoma and the hairline. Oh, I'm going to draw out this picture here quickly. Okay, so the foot point. Okay, so here gastrocnemius. The gastrocnemius point, like it's around small intestine 19. But here coming to the foot point, this point has a direction of needling. All points in YNSA don't have a direction of needling. This point has an effect in the direction of needling. If you needle the point from anterior to posterior, this direction, you're gonna treat the plantar area of the foot. If you needle it from posterior to anterior, you're gonna affect the dorsal area of the foot, okay? Now, as you can see, the point is located on the hairline, right on the hairline. And as you can see on the left picture, you can see it's right on the zygomatic bone. So if you just go above the zygomatic bone and then go slightly down onto the zygomatic bone, right on the hairline, anterior hairline, that's where the foot point is located. That's another very, very useful point. A very good combination for heel spurs or any disorders for the area of the feet is that gastrocnemius point with the foot point, especially for heel spurs and plantar fasciitis. And even a neuroma, they can be very, very useful. The next point I want to speak about is shoulder. Shoulder, again, it's any problem with the shoulder, very, very effective. As you can see here, if I have the mandibular angle, I just go from the mandibular angle, I go on a 45-degree angle onto the mandibular angle, and that's where the extra shoulder point is located. Very, very useful, again, for shoulders. Second point, fourth point that we'll speak about here, if you can see here, again, in the skin level, as you can see, mandibular angle, 45-degree angle onto the mandibular, right at the corner of the mandibula. That's the extra shoulder. Then we have the extra lumbar point. The extra lumbar point is another point for the lumbar. It's in the midway on the mandibular bone, right at the edge of the mandibula, at the lower border of the mandibula, on the midway between the center of the chin, the mid-sagittal line, and the mandibular angle. Okay. We actually have a video for those pictures. So I'm going to full screen here and we'll show you the video. So I'll just be quiet, I'll explain as we go on.
Okay, the first one is the foot. So I'm on the zygomatic bone. Like this. No, it's the highest cliff of the zygomatic bone. I want to be on the second zygoma. Okay? And like we said, it's like that. Okay, so you're needling plantar side, you're needling anterior to posterior, dorsal side to posterior to anterior. Okay, that's the foot. Yeah, it's bilateral, but you are needling in the same side of the symptom. If it's a toe, it's all for all sides of the foot. I don't think you need. I never, no, it's really one foot to the same side. Okay, and to find the gastrocnemius, I'm just palpating and finding this notch of the mandibular joint. Again, if you are having problem, just ask him to open up the mouth and you will open up the jaw itself. Okay, and this is the point.
That's the gastrocnemius point.
I will needle from there, if you ask. Yeah, I will go like that and needle the point. If you want, I will show you the needling technique after that. Okay, so this is the gastrocnemius. And now we are going to the extra shoulder. So we have the mandibular angle and I'm going like that. You see, I'm a bit moving the skin and all the area towards the notch here. Do it like that. basically it's it's the upper part, the dorsal part. Yeah. It's also okay. And this is the extra shoulder point. Yeah. This is basically here's the pathetic.
What you can see here, the black line.
To be clear.
Okay, the black line here is the mandibular angle, and then a 45-degree angle onto the mandibular angle, reach the extra shoulder, that shoulder point. Here is the, okay, so here is the point where Avi's drawing is the midway between the mandibular angle and the mid-sagittal line, right on the mandibula is the extra lumbar point. Okay, move to the next. Okay, coming. We coming here up to another point, which is very, very useful, which is the soleus point. Okay, I'm going to enlarge it. Soleus point and points for treatment, and the malleolus point. Okay, we also have a video for them. But in general, if we look in here at the soleus point treats the palm of the hand, any disorder of the palm of the hand. You have the medial soleus and the lateral soleus. Okay, again, left side will treat left side, right side will treat right side. On the medial side, it's around kidney 7. And on the lateral side, it's around bladder 59, UB 59. Actually, what are you looking is, you're looking for the area where the soleus muscle integrates and starts becoming the Achilles tendon. And what you do, what you can see here in blue, the lateral, what I'm showing here is actually UB9. The area, the lateral soleus muscle affects any problem in opening the hand, any disorder or pain caused when you open the hand, more of the extensors, then you need to needle that point on around UB9, UB59. Okay, if you have any disorder in closing the palm of your hand, trigger finger is both of them, Decker-Venn is both of them, but any problem in closing your palm of the hand or spasticity to hyperextension and you want to cause more of flexion or help the palm of the hand close better, then use the medial part which is around kidney 7. Now you don't have to go too deep in needling here. You can even needle very superficial of a few millimeters and have a very good effect, but sometimes you might have to go deep. What I usually do is usually palpate the area, and at the same time I ask the patient to move his hand. Once I found the area where he gets the good improvement, that's the area that I insert the needle into. So that's the soleus. Then we come into another group of points, which is around the malleolus, which are very, very useful for treating other different parts of the body. Okay, basically, the difference between the medial soleus and the lateral soleus, that the medial soleus will treat the anterior body. Okay, take a coronary cut, mid-coronary cut. So the anterior part will treat the anterior body, the medial part, and the lateral will treat the posterior body. Okay, and it's divided, and the area again, the medial, right at the tip of the malleolus is the brain. Okay, the tip of the malleolus is the brain area, so that affects the anterior brain, and then on the lateral will affect the posterior brain area. You're just going to know where the areas of the damages and use those. And then coming, what we have, UB is upper body, MB is middle body, LB is lower body. Okay, the UB is right below the soleus, right below the malleolus, right directly below the malleolus in a 90-degree angle down in the center of the malleolus. That's the area of the upper body. That means upper extremity. It means from about the upper extremities and the upper neck and the head. That'll treat that area. Middle body is the trunk, the thoracic, up to L5. Okay, and that's about a centimeter below the MB point. And then the lower extremities, the lower body, is the area between actually the plantar fascia and the calcaneus, below the calcaneus and the plantar fascia area. That is the area where you insert the needle, and that'll treat the lower body. Now, these points will be sensitive, and you can always, and sometimes you might have to go a bit play around with them to look for the sensitivity. In general, these are also very effective in motion disorders, any movement disorders like Parkinson's, MS, with ataxia disorders are very, very useful. And like I said, the lateral treat the posterior body, the medial treat the medial body. I will show you a video here. I'll just make it a bit. Here we go, the video of the location of the points. So I'm going towards I'm starting with the soleus point. Okay, so the lateral soleus, I'm going to around kidney 7, 8, and looking for sensitivity. Okay, that's the medial soleus. This region here. And in this region here, I look for sensitivity. When I found an area that's sensitive, at the same time, I can ask the patient to move his hand. This will be to close the hand. Any arthritis, for example, or any disorder in the flexion. Okay, then that'll be the medial. That'll be the medial. The lateral. Okay. Lateral will be around this region as well. Can you see? There. That'll be the lateral. And again, this will be looking for sensitivity, and then that'll be needling and asking the patient to open his hand. Okay. So now I'm going to just draw out the malleolus here, okay? These. Drawing out the borders of the malleolus. These are the body, okay? So this is like the lower border of the malleolus. Okay, and this is the ligament that I'm speaking about. And here about is the calcaneus muscle. Calcaneus bone, sorry. The bottom, in between. You with me? Now, so, right at the center, this is the center of the malleolus. This is going to be the Parkinsonal brain. Yamamoto calls it Parkinson. I just call it brain because it affects other, just because I don't want to keep you only think of Parkinson's. Then we have the bottom malleolus. Okay, just below 90 degrees. Malleolus. This area is the upper body. And then I just go down, look for them. Oh, so it's more up. This is the area in between the calcaneus and the ligament, plantar ligament, which will be the lower body, and in between the two will be the middle body. What I was saying that if you roll towards this side, and it's like I put in arrows. What I mean, okay, these are meant to be arrows, but what I mean that if I have a point, if I roll towards this way, I'm going more medial in the body. If I roll more to this way, look, sit there and go lateral. So medial body, let's say. This will be sagittal line, okay? Let's say right on the sternum. And if I go back here, I'm going to the areas of the lateral borders of the sternum, okay? If I'm here, I'm going the medial part of the foot or the legs, lower part or medial area right on the center around the navel and posterior lateral to the navel. For example, you with me? Yeah. Okay. Now the same idea, principle, will happen on the lateral. So, sorry. Okay, so lateral. This will be the Parkinson. This will be upper, lower, and medial. With me? Okay. Now here you can needle deep. I usually use one soon. Go one soon in. Okay. And when they're in the treatment, if they're not in the treatment. Okay. So if you guys okay, we only have a few more. So now for the next group of points, we have to learn of a couple more. We have to learn two basic points, two major basic points for the new points that Yamamoto spoke about. So one of the two basic points we need to learn, the location is the A point. The A zone, which you see here in black, treats, it's a basic point, one of the basic points. It treats the head down to C7. Now this basic point not only treats the cervical spine, but also treats from the skin inwards, okay? More treats the region. Where the upper area will treat the head, the lower area will treat C7s. When you cross the hairline, that's around C3-4 area. Now this point is a 2 centimeter vertical line, which runs from 1 centimeter into the hairline to 1 centimeter below the hairline. And it's located approximately 1 centimeter lateral to the mid-sagittal line. Okay, that's the A point. As you can see, if you're not sure where the hairline begins, it's actually the connection between where you can see here where my natural hairline used to be. It's actually at the superior borders of the frontalis muscle. So if you ask your patient just to contract to pick up his eyebrows, you can actually see where the natural hairline used to be located. And approximately lateral is approximately the area of UB2 line. Okay, that's the A point. Next point we'll move into is E point. In a minute, E point is a point that treats the thoracic spine. Okay, it's very, very effective for cardiovascular disorders, pulmonary disorders, breathing disorders, heartburn. Okay, again, it's a line of about a 2 centimeter line. Okay, it is a 2 centimeter line. And as you can see, it sits right in the superciliary ridge. Okay, the superciliary ridge, if I have my eyebrows, feel my eyebrows and just go up, and then I feel myself in a ditch. And it starts from the pupil line, and it goes medial, medial, medial to around UB9, where the area of the superciliary ridge integrates into the glabella region of the frontal bone. Okay, so it's around the pupil line is T1, and as you go down, you found yourself around UB2, that's T12 area. So that's the E point. Now, they're very, very effective, very, very useful, but I'm showing you these points. I'm gonna try and draw them here. Hopefully it works. So I'm going with my pencil. So first of all, I'm drawing with red, I'm drawing my hairline, approximately. That's my hairline. Okay. Sorry, I'm a bit skewed. Okay, then I'm going to take the color black. Okay. It's going to be, this is my mid-sagittal line. Okay. I'll change the color again. Go to blue. So like I said, if you see areas around UB2 and I go straight up from UB2, approximately a centimeter lateral, 1 centimeter into the hairline to 1 centimeter below the hairline, that's the A point. And then I'm going to the E point. If I have my pupil line, I go directly up from my pupil. And here I'm in the superciliary ridge. You can even see it. This is where my crease is. Right to, I finish in the same line as A. This will be T1. This will be T12. So I have these two areas in between. Now, the reason I'm showing you these points, especially so you can use them, of course, but I'm going to show you what is called, these are new updates of Yamamoto. Okay. These are updates, sorry. No, disregard. Sorry. Okay. These are updates of Yamamoto from 2018 of points that are very, very useful. If you think about it, that you have the thoracic spine and you have the cervical spine, you have to palpate down and you have to start looking for the most sensitive point. So basically here you want to actually pinpoint it to one point in the end that'll treat the general area. So if we can have here we have the A line and you have the E line. In between you have three in equal divisions, one from each other. You have a couple of points. Now the lumbar spine, it's actually a man's upside down. What you can see here in yellow is the lumbar spine. So if we have a line, if I would draw, here was my drawing of a line. I'm gonna go. Okay, and I can have my pencil. Okay, if I would draw a straight line in between the A and the E, okay, and I would take the points, the medial points, which you see here, okay, if you take those medial points and you put them in equal divisions between the A and the E, and a bit medial to that line between the A and E, the yellow line will treat the lumbar spine, the middle one will treat the thoracic spine, and the lower one will treat the cervical spine. These are the first points you needle. Okay, if you have a lumbar pain, look for the sensitivity in the lower yellow. And if you don't have more of effect, then you go to the more lateral. And again, you go the lateral, you go a bit lateral and up, and that'll be it's another boost to the lumbar spine. The same, you have the thoracic, and the same, you have the cervical. Okay, but what is important that the medial parts, if I would take these would, I'll go back to the other drawing. I'm going to the drawing here. So let me draw that A line. Okay, if I have my A line and I have my E line, and I would put points in equal divisions. Okay, so that I would have, that'll be the lumbar, thoracic, cervical. So you can see a little medial, and then the upper will be lumbar, thoracic, and cervical. When there's a gap, there's nothing in between them. But what is important, the medial parts are in equal divisions between the inferior border of the A and the medial border of the E. These points are very, very effective and very useful, and they give you a quick and fast result.
David, people asking if you can show them regarding to the mouth, nose, eyes point, the sensory orient.
Okay, we have sensory points. Yeah, so let me go back to my previous. Okay, so we have eye, nose, and mouth. Okay, what you can see here. So now we have the opportunity of drawing again. Pen, okay. So I'm drawing A. Okay, if we have A and we have E. Okay, sorry if I'm skew A and E. So the eye, nose, and mouth are right on the center between the inferior border of A and the medial border of E, right in the center. What you see here, the red line, that's where eye, nose, and mouth would be located. And then at the same height as eye, nose, and mouth on the medial would be, this will be lumbar, this would be thoracic, and this would be cervical, okay? And the upper will be lumbar, thoracic, cervical, okay? Is that understood? So that's according to those points. I'm just going to erase it. Okay. So just before we start sum up and see if you have any questions, I'm just going to go into a case study where these points were used. So the case study I spoke about it on the Facebook was a patient walked into the clinic that was suffering from trigeminal neuralgia. He was diagnosed by his neurologist with trigeminal neuralgia. And basically the neurologist said to him, you're going to have to live with it. Now, his problem was that every time he shaved around the mouth, he got a very sharp, sensitive pain. Now, when I started, in his intake, one of the first questions I asked him, then he said to me, look, I had another episode of something very similar where I had pain around my jaw about 10 years ago. And then I asked him what happened 10 years ago. He said, nothing, it just appeared after some day. It just started appearing this pain. It was there for a couple of months, and then it was gone. And again, then they diagnosed with trigeminal neuralgia. He took, they gave him steroids, and the pain went away. I don't know why they gave him steroids. And then my next question was if he ever had ever suffered from a concussion or ever had an accident, a car accident. And he said, yes, a year before that I had an accident. And when I had that accident, I asked him, he said, yes, someone from behind really came into me very strongly, and my head, I had a very strong whiplash. He said, do you have any effect on your neck after that? I said, well, for a couple of days, for about a month, I had pain in my neck, but then it was gone and disappeared. And then a year later, disappeared that pain that he had around his jaw. And then, so I started, the next day I came and I palpated his neck. I saw his neck was very, very stiff. And then I said to him, and the thing is, he was suffering for this for trigeminal for 5 years, for 5 months. So the doctor basically said that he's going to have to live with it. So I actually started saying that I don't think the problem, I started thinking and starting doing the diagnosis, palpating around. And I actually saw that the area of his around gallbladder 20, gallbladder 19 was very, very stiff. And the fascia there was very, very stiff and strong. And when I just touched it, it was very, very sensitive. Now, if you take it, the jaw is rested also on the neck. Okay? So I started thinking in the case that actually his problem was not he doesn't have trigeminal neuralgia. He's actually having some stretch. And again, going back to the fascia that stretches, and then called a strong stretch. A strong sensation of pressure will cause pain. And especially when you're shaving, you're actually increasing the pressure, and then you actually get in that sharp pain. But it's got nothing to do with the trigeminal nerve. It's actually the fascia that's stretching back, and then more tension there. And that was just by palpating and feeling that area. So I actually combined these points to treat it. I used the A basic point, like I said, to treat the upper area. I use the upper body of the area of the malleolus. And if you think about that, upper body sits on the Taiyang channel, on the foot Taiyang. So I'm actually also affecting the foot Taiyang. I use the new cervical spine. The new cervical spine is the point which I showed you here. Okay, and then I also use body acupuncture. I use UB56 with small intestine 1 and 3. The foot was contralateral, like the pain was on his right side, so I needled the bladder 67 contralateral, and small intestine 1 and 3 ipsilateral. And then afterwards, after that, after the needling actually turned him over, I needled 14 for about 10 minutes. And then I started manipulating with the fascia and relaxing the fascia with a massage, doing a fascia manipulation there to that area. And after this treatment, within 5 treatments, the pain was gone completely and he was back to normal and even felt other things. So that's just using these YNSA points. They're very simple that we actually relax that area with the body massage, which I always believe that it's a good combination. And we got excellent results. And here's a combination with YNSA with using body acupuncture. So now between point and point that I needled, I always used to come and put pressure in the area of the mouth to see if it improves. So already after I used the A, this is also the order of points. After the A basic points and the UB, the upper body point, he actually felt that when I put pressure, I had to put more pressure for him to have that sharp cut-in pain there. So they were very, very effective. So, that's basically it, guys. That's our seminar. If you have any more questions before we sum up. Yes, Sean?
Most of the questions we answered in the chat. We have another 3 questions that I waited for you. Let's see. So yeah, can you see last questions here, David?
Let me just see. I'm trying to get the chat open.
Okay. So Nikos asked about how deep the needle goes in. So like David said, we are trying to get the fascia or some kind of a feeling of the granule in the subcutaneous tissue. Okay, we try not to meet the bone. Sometimes, a lot of times in the start, you will hit the bone. The only thing that can happen is some kind of a crown-like headache for about 3 hours. We're for to connect one point to each other or to thread, like we call it. We are not using in YNSA usually threading techniques. Usually we want to hit with the edge of the needle directly to the sensitive point. So not this kind of technique. There was another question that I didn't understand, if medial treats medial. So we are treating in the, if I understand the question purpose, so we are needling in the same side of the symptom. Okay, that's the point we choose for now, for these points.
We actually, the points that I taught you here are always ipsilateral to the symptom. I haven't gone into the diagnosis, which is the whole group of other points that you have to use. Or you not use. There's a diagnosis that we haven't learned here. It's a bit more difficult to teach a diagnosis on the online, but these points are mainly used for the ipsilateral. There's no diagnosis for them. You just needle them on the same side.
Yeah, so same side to the pain. There is no, we are not doing any stimulation. We're putting the needle and that's it. You don't need to do stimulation. How often? So it depends on the problem, but we like to start with, if it's very acute or very painful syndrome, we would like to start with a big stimulation. So we're going for like twice or 3 times a week, and then we spread it to a week and on according to the development of the problem. Okay, the problem improved.
I see there's another point of the direction of the foot point. So if you want to affect the plantar foot, you needle from anterior to posterior. If you want to affect the dorsal foot, you needle from posterior to anterior.
You want to answer about the duration of the therapy?
The duration of the treatment is usually I leave the needles in for a minimum of 30 minutes in average. But the duration of the treatment can run in acute stages, can go from 1 minute to 20 minutes, or from 30 minutes to even sending the patient home with intradermal needles or ASP needles. So a lot of times in acute situations, you'll get a very, very fast effect, and it's not necessarily the duration will go up to the 30 minutes, but I just for average leave it in for 30 minutes.
Again, the eye, mouth, nose point that you saw, it's another group of points that we didn't speak about. That's why it was on the picture there. I think we over all the questions. Yeah.
Okay, so I'll just go back. So, can you see the screen now?
No.
No. So let me just do the screen. If anyone wants, I'll
In the meantime, if you put the screen, the needle size, it's not so important as long as you hit the point. We are using 20 by 30 needles. Yamamoto use 25 by 40, but really we found it even with thinner needle we can work.
Just 1 minute. Let me get so you can have our contact information. So what the, sorry. So I see it's okay. I don't just color everything here so you have it. This is our contact information. If you have any questions, feel free to contact us or by email or by Facebook. Like we said, this recording will upload to the Facebook. We'll have it on our, if you want to join our group, we have YNSA case study group. You can join there. I'll upload it to there, the recording. Also on my profile, I'm sure how all the groups that you entered, I'll also upload to there the webinar so you can see, have the recording itself. Yes, I see we have someone who raised his hand. Ted? I see Ted.
A couple of more questions if you want to answer. You can follow.
That's in the chat.
Hi guys, I'm sorry about that. I'm trying to figure out how to write something down and I accidentally hit the raise hand button. This is a fantastic presentation. I really enjoyed it, but I'll send you the information, what I wanted to say as soon as I figure out where to put it.
Okay. Okay, thanks, Ted.
Okay.
So you have our contact information, use it, or you can even feel free. I hope you enjoyed this evening. I hope all of you keep safe, your families are safe.
Yes,
You know.
hear me? I have a question.
Yes.
Well, hello, I have a problem myself with my back and I have a cervical pain both in my left and my right side. So, am I needling in cervical spine points in both right and left side of my face?
With the, if you could diagnose where it's coming from, then I would use only the side that you know it's coming from. But if for this case, with these points, I would needle bilaterally right now.
Okay. Okay, I got it. Thank you very much.
Okay. So thank you all. This is our contact information. Hope hope you enjoy it. Whoever wants to read more about YNSA, our book is coming out in June, on the 18th of June, which is a really good, we try to explain everything step by step. It's written, the person who edited it was my father, who does know, today he's specializes in scalp acupuncture, just where he brought the level to a stage that you can, a kid can read it and understand how to do YNSA. So it's coming out in June. You're more than welcome to purchase through Dragon, Singing Dragon. So, and thank you, Ted, for doing proofreading. Thank you. Thank you all. Have a good day, all of you.
Thank you, everybody. One last thing, people asking. So the group of the Facebook is YNSA case study group. You can ask for join. For me also.
Out here.
Yeah, I did. So for me also, I'm saying thank you, everybody. I hope this weird situation that goes in the world will go, and we are going to get back to the roads quickly. And thank you.
Thank you.
Thank you.